Hello everyone, once again welcome to my Oet channel. So this is after a long time I'm just doing the video of Oet exam introspection. So today we had exam that is 2nd September 2023 and I have some details about the Oet writing topics. So one was non-case to the patient's GP and another one letter it is for the rehabilitation manager. So the manager of rehabilitation center. So anyway, first we will see what was the question regarding the letter to the rehabilitation center manager. So this condition is related to stroke. So as usual, today's date is 7th January 2023 and this patient was brought to the hospital following collapse at home. So upon admission, they did MRI scan which revealed stroke. Then during hospitalization, they have managed the patient with rectiplace and clopidogrel. Subsequently, she was reluctant to walk as she is afraid. She or he, I'm not sure about that, afraid to fall. And during hospitalization, they have initiated exercises like physiotherapy and speech therapy. She was cooperating to that since her daughter is not able to take care further. So they have discussed regarding the rehabilitation center admission and take grade for that. So that is the reason why we are writing the letter to the manager. So this is the overall idea about the letter. So how we can write, so the date and as per the writing task they used to give complete address, you can write there. Then you can write, if they have given the name, you can write dear, with the surname. Then you can introduce patient's full name. I didn't get the complete name and gender, age and all. Then in the introduction you can just write that I'm writing to refer the name, the complete name you can mention, who is suspected to have stroke or who has stroke. Maybe if they have given like ischemic stroke or something, means you can mention the complete diagnosis. Then you can write she or he requires further continued care or ongoing care or follow-up care, because we don't know for how long she will be there. So if it is mentioned, if it's only for 1 week or 1 month or 2 months, 3 months or something like that, if they have mentioned, you have to write it's like a respite care, or else you can write continued care, ongoing care or follow-up care. Okay, then you can write she is being discharged today, okay, into your facility. That is a introduction paragraph. And the present medical paragraph, you can just start like when she got admitted. So you can mention on this date, you can write with the patient's surname, was admitted, okay, was admitted following a fall. Then if there is any signs and symptoms, if it is there, you can mention with these complaints. Then you can write during hospitalization or during admission, he or she has undergone magnetic resonance imaging scan which revealed her diagnosis. So again, don't write the diagnosis, you can just mention the diagnosis. Then during hospitalization, she or he was managed with the place or the term they have given, you can mention the same medication as well as clopidogrel. And if they have managed with any other medication, you can include there. Then you can write subsequently he or she has been initiated with it, because these therapies will continue because for a stroke patient. So don't write was initiated, you can mention has been initiated with physiotherapy as well as speech therapy, which needs to be continued. If you want, you can write there, but don't mention it again in the recommendation paragraph. Then you can mention gradually she made progress. Don't use the word good progress because it's a stroke. So you can just write progress. And if they have additionally, if they have given any management, you can add here also. Then at the end, you can write subsequently she made progress and ready for discharge. Then you have to mention what is the exact reason for the referral to the rehabilitation center. Okay, nobody used to write there, but I'm strongly recommending you to mention what is the exact reason for the referral in all type of letters. So we can use with a since. Okay, here you can use since her daughter is not able to take care her, comma, she is or he is being transferred into your facility. But take care, the sentence should not be same like introduction. Okay, if you have written that transferred into your facility there in the introduction means you can just change here. Okay, it's being referred into your facility. Then you can write, please note, the transfer has been informed to the family, and her transfer, okay, his or her transfer has been informed to the family and they agreed for it, or they agreed for it. That's enough. This is the reason for her referral. So that's enough in the present medical paragraph. Then when we will come to the social paragraph, I don't know whether he or she or widow or widower, you have to mention that. Then you can write who lives alone. Okay, then you can write her daughter helps in householding activities. Then you can write about the medical. She has hypertension, hyperlipidemia, arthritis, and depression, for which she is on medication. If they have given medication, surely you have to write all medication with the dosage, everything, because it's admission to the rehabilitation centers. You have to mention everything. And if they have given the year of disease condition, you have to mention with the has had. Okay. Then in the recommendation paragraph, of course, you can write maybe if they have given some recommendation, you can mention maybe the continuation of medication or physiotherapy or activities. Sometimes they used to give for the diet, encourage the physical activity, mobility. These things and all will be there. I'm not sure about what are the recommendation they have given today's exam. But you can mention like this: it would be appreciated if you could provide assistance for, you can write the patient's name in daily living activities. Or if they have given like physical mobility or something, you can write kindly encourage her to perform mobility or something according to the recommendation you can mention. And if they have given medication, please try to write it in the starting itself. Okay, all medication information have to be in the starting, then you can write the remaining recommendations. So like this you can sum up. So this is the first one writing question. And in some other like in Gulf countries and in European countries, actually they asked the non-case. So this is the letter to patients on GP. So that was the non-case. And actually we are the community health nurse, and we are going for a home visit. When we went there, we find out that patient is suspected to have second stage of lymphedema. But I didn't get complete information regarding this writing letter. I got only this point. Okay, so this is a non-case letter, and the purpose of the letter is for the further assessment and management. As usual, recommendation paragraph will not be more, but you have to concentrate on present medical paragraph. Why we are going to the home. There will be some reason. Maybe other than this lymphedema, there will be some other reason. So you have to start with that. Then the next paragraph you can write today, during today's home visit, what are the things you have seen and why you suspect. That's why you are referring this patient to the GP. So this this paragraph will be big. So you have to make it two paragraph. Okay, because there will not be social paragraph because it's a non-case, and recommendation paragraph will be only one sentence. It would be appreciated if you could take over the case of Mr. or Miss the name to evaluate her condition and provide specialized intervention as you feel appropriate. This only one paragraph, one sentence will be in the last paragraph. So the letter will be very small. So what is the reason behind of your visit? That thing you can start with as you are aware. Okay, so you can write the reason. Then in the next paragraph, you have to mention what are things you have noticed during your home visit, today's home visit. Okay, so like that, you can sum up. And regarding the speaking, I got 4 topics. So first one, it was the patient clinic. Patient came with a hearing impairment, and in assessment we found earwax, and this patient is for earwax removal, but patient is reluctant for that, but we have to convince. So that was the scenario. Second one is related to flu vaccination. Patient want to know about the flu vaccination, and this flu vaccination actually they have asked many times before also. So there will be repeated questions will be there. And if you are going to my Telegram group and if you search in the file section, you can see PDF. I have uploaded many role play cards. There will be 100 plus role play cards will be there from 2020, 2021, 22, 23. So you can utilize every cards as much as possible. Try to utilize it. So one among them you will get for your exam. Then the third one, it was the home visit. It's for removal of stitches after hernia. So you will assess, you will explain the things to the patient. And the fourth one, it is in the emergency department. Same like this role play card we got few months before, swallowing button. It's a baby swallowed button. The same like that only. Here, baby swallowed coin. The father is or the parent is concerned about the incident, but it was not present actually in the respiratory, or it is not there, but he or she is concerned about the thing. So that's the thing. You have to utilize maximum old role play cards, so it will be very easy for you to prepare, because they will ask more or less same type of questions. One home visit will be there, one community health visit, home visit, one community health clinic, and one hospitalized patient, one discharge procedure, and rarely they used to ask regarding the like rehabilitation center or like a nursing home visit. And there will be discharge discussion, parents discussion will be there, the talk with the parent, it will be there. So these are all the common cards they used to ask during the exam. So if you practice these, speaking will be very easy for you. Okay, so the letters also, mostly they will ask either non-case to the GP or referral to the own nursing home, or else any medical letters. And recently they asked social worker letter and physiotherapist letter. So these are only the thing they asked after a long time. So non-medical also you have to concentrate, and even these type of letters are in my Telegram group. I will keep the link in the description box so you can see, and you can access to the question papers and the speaking cards. And if you want to get the guide, it's available from me for the writing. Actually there are 50 exam questions, like previous exam questions with answer, 25 non-medical letters with question with the answers, and in the starting there are some OET grammar, important OET grammar, as well as the basics from A to Z basics of OET letter writing will be there in one guide, and it's costly 3,000, and if you are inside India the courier charge will be free. But if you are outside, it's always better if you have someone in India, means we can send to them and they can bring it them. Or else if you want to courier it to your place, you can just contact with me. So my phone number, everything will be given in the description box. You can get access. And another one, speaking guide with USB. There are some videos, like basic videos for speaking. You have to know, especially if you are trying like nearing your exam. And there are 100 speaking cards. It will be like in a book you will get, and the same card explanation will be there in the USB, so you can access to that. Then there will be guides. There are guides for listening and reading. For listening there is attached USB, so if you want to get the guides, you can just message me in WhatsApp number and we can send to you. And if you want exam crash course, because I'm working here, so I could not take like regular classes for writing, so it will be like a letter voice correction. So you can message me. After the payment I will send you the recent exam questions. Okay, it is not in the Telegram group. The different question papers I will send to you, and I will mention some 6 or 7 common questions. From that only you will get the question papers. The same type of questions. So it will be easy if you by heart. If you by heart the rules and regulations. So you can write and send me anytime. So when I will get my off days, I will send a correction with a voice note. Okay, case note explanation and your letter correction. For speaking, I can arrange the speaking sections on my off days and as per your time. So it will take time, because if you are joining for 15 speaking means it will take 8 classes. 8 classes means weekly. Maybe I can take 3 days. So it will take 3 weeks. Okay, so if you want to if you are preparing for exam and if you want to join with me, you can just join earlier, like at least 1 month earlier. Okay, so there will be per class there will be 2 speaking sections, and I will give you the corrections as well as the suggestions and all. So this one also related to the recent exam questions only, like 20, 21, 22, 23. Okay, so if you need any assistance in OET preparation, just drop me a message in that WhatsApp number. I'm here to help you. Okay, we will see you with another one informative video. Until then, bye, take care.